once again, as we mentioned before, welcome. And the foundation of the rules, we wanted to mention that the Arizona Revised Statute is the law, and the rules are then come below or are derived after the statute. They're based on that law, which is the statute. Your responsibility as a provider is to review those rules, which is what we're going to do today, and then to understand those rules and to be able to demonstrate compliance to those rules as we go forward. As I mentioned before, Article 1 has some of the definitions that apply across the board. Healthcare institution classes and stuff. You can see the list there. We have healthcare institution classes, subclasses, licensure exceptions, approval, architect plans. All of that is now all housed in Article 1. And so we have also have some definitions, the renewal of the license applications, the time frames, changes affecting the license, enforcement actions. Those that are in red are things that have been added to that, to the rule, to Article 1. Definitions in the Arizona Administrative Code, Article 1 is R910-101. As you go on that website, if you want to look at that specifically, that's the address, if you will, where you're going to find the information about the licensing, all of those things that we just looked at in the last slide. Arizona Administrative Code, Article 12, R910-1201, that starts the home health rules. And that also, and then for home health, the Arizona Revised Statute is 36, and it's the 400, -400. For all that resides in the law. Administrative Code, the agencies, for this agency we have, it's the whole slide on there, okay. Definitions is in 01, supplementals in 02, supplemental application requirements. Administration is in 03. You can see that's just, it goes down and it is sequential, including quality management, contracted services, personnel, care plan, which used to be called the plan of care, and patient rights, medical records, home health services, and supportive services. They're all there. They just have a different address, if you will. Starting with the definitions. So now we're going to start into the rules themselves and go through them. Those things that have been either added or they have the verbiage is a little different was put in that kind of gold color. So that can stand out to you. The branch office means the location. The branch office is in the old rules, but now we have the definition means a location other than a home health agency's main administrative office that operates under the license of that home health agency and is under the control of that agency's administrator. The second definition is home health services director. And that means an individual who provides direction for the home health agency provided by or through the home health agency. And then the medical social services means activities that assist the patient to cope with concerns about the patient's illness or injury, and may include helping to find resources to address the patient's concerns. I know you had each of those in the old rules, but the definition of verbiage is a bit different, just to point that out to you. Under Section 1202 is the supplemental application requirements. And these are supplemental to what the application requirements are in Article 1. So these are specific to home health. It needs to include the name and address of each proposed branch office, if applicable, and the geographic region to be served by the proposed home health agency administrative office and each proposed branch office. To submit to, anything that you submit to the department submit to the department a copy of the valid fingerprint card issued according to ARS Title 41, Chapter 12. If the applicant is an individual or each individual with a 10% or greater ownership of the business organization, if the applicant is a business organization. So that means you have more people that are required to have the fingerprints than you had in the old rules. And then 1203 is now administration, the section is administration, and there are certainly a number of new items here. The governing body shall consist of one or more individuals responsible for organization, operation, and administration of the agency. Designate in writing a home health agency's scope of service and the qualifications of the administrator. So the department is not telling the facility or the agency what the qualifications are for that administrator. The agency makes that determination and has that in writing. Designated, let's say, adopt a quality management program according to R910-1204, which is the next section, which is quality management. We'll go through that in just a moment. Review and evaluate the effectiveness of that quality management program at least every 12 months. Designate in writing an acting administrator who has qualifications established in subsection A to B if the administrator is expected to be not to be present in the agency's administrative office for more than 30 calendar days or is not present in that agency's administrative office for more than 30 days. Except as provided in subsection A6, notify the department according to the Arizona Revised Statute 36-425I when there is a change in the administrator and provide the name and the qualifications of that new administrator. So that information has to be sent to the department if that happens. If we have a change in administrator, we need to see that needs to come to us as well as the qualifications. This is not particularly new, the appointing an advisory group, but we did include in here the Arizona Revised Statute, which speaks to that. I think the verbiage is a little different than in the old rules were, but you need to have a physician, a registered nurse who has at least 1 year of experience, and as 1 year of experience as a registered nurse providing home health services, and 2 or more individuals who represent a medical, nursing, or healthcare-related profession. Once again, we have time frames that are a little different from the old rule. This one, it speaks about the advisory group is appointed according to subsection A8 and meets every 12 months. And it used to be 6 months. So that's giving you a little bit more leniency there. And then the administrator, the new area here is except as provided in subsection A6, designate in writing an individual who is present at the home health agency administrative office and available and accountable for the services provided by the home health agency when the administrator is not present at the home health agency administrative office. And if you caught that nuance, what we talked about earlier was if they were going to be gone for 30 days or if they were gone for 30 days. And this one is speaking now at each time that administrator is not there, there needs to be someone designated who can be accountable and run the administrative function for the agency. And ensure compliance with ARS 36-411, and that's the law that speaks to the residential care institutions, home health agencies, fingerprinting definitions. So the definitions and the requirements for fingerprinting are in statute as opposed to in law, as opposed to in rule. As you can see, it's a relatively long statute. Next item is an administrator shall ensure that policies and procedures are established, documented, and implemented. And as I mentioned, this is significantly different kind of a format than you saw in the old rules. The department is saying now it is time for the agency to have policies and procedures that speak to these issues. It needs to include a job description, duties, qualifications, including required skills, knowledge, education, and experience for the personnel members, employees, and volunteers. The policies need to cover orientation, in-service education for personnel members, employees, and volunteers. In each case, it's all 3 areas: employees and volunteers and personnel members. Cover how a personnel member may submit a complaint regarding patient care, and I believe that is new, certainly from the old rules. Include a method to identify a patient to ensure that the patient receives the appropriate services. The policies need to cover patients' rights, including assisting a patient who does not speak English or has a disability to become aware of the patient rights. So assisting them, a rule, policy, procedure to assist them to become aware of their rights whether they have disabilities or whether they speak English or not. The policy and procedure needs to cover steps and deadlines for a patient to file a complaint, for a home health agent to respond to and resolve that patient complaint, and for the home health agency to obtain documentation or fingerprint clearance if applicable. You need to have policy and procedures that cover healthcare directives, medical records, including electronic medical records, quality management program, including incident reports and supporting documentation, contracted services, designate which personnel members or employees are required to have current certification in CPR and first aid. Ensure that those policies and procedures for services provided for a home health agency are established, documented, and implemented once again. And we have another list here that cover patient admission, discharge instructions, and discharge. Cover the provision of home health services, if applicable, supportive services. Include general consent, informed consent as required, medication procurement, if applicable, and administration, and infection control. And then the next item is ensure that those policies and procedures are available to the personnel members, employees, and volunteers, and reviewed at least every 2 years and updated as needed. Just a word there, as far as being available to employees, the employees need to know what those policies and procedures are. If they're kept electronically, they need to be able to access those and access them readily. And if they are hard copy, they need to know where they are and be able to access that information readily. To ensure that records of the advisory meeting group are maintained for at least 2 years. And then the next change, it comes under designated in writing a home health services director who is, this is new, has at least 3 years of nursing experience, including at least 2 years of experience as a registered nurse providing home health services. That last clause there is added to what previously was in the rule. Ensure that speech or speech therapy or speech-language pathology services are provided by speech-language pathologist licensed according to ARS Title 36, Chapter 17, Article 4, or speech-language pathologist assistant licensed according to ARS 36. And you'll see that all of those licensing requirements for individual professionals are listed are found in the statute Title 36. I'm sorry, Title 32 and 36. Occupational health services provided by an occupational health services, once again, as licensed according to ARS Title 32. And for physical therapists, the same thing is the licensing is according to Title 32, Chapter 19, or physical therapist assistant certified according to ARS Title 32, Chapter 19. And in respiratory care is provided also by therapists or technician licensed according to ARS Title 32, Chapter 35, or by a registered nurse in this case. Pharmacy services are provided by a pharmacist licensed according to ARS Title 32, Chapter 18, and medical social services are provided by a medical social service under the practice of a social work as defined in ARS 3251, and by a clinical social worker licensed according to statute 3293, or a licensed baccalaureate social worker according to ARS 3291. For other medical social services by an individual with a master's or higher degree in social work who has at least 1 year of social work experience in a healthcare setting, or by a licensed baccalaureate social worker according to ARS 3291 again. The agency needs to ensure that the services specified in subsection B6 are provided to a patient only under order of a patient's physician, registered nurse practitioner, or podiatrist as applicable, and unless otherwise stated, ensure that the documentation required by this article is provided to the department within 2 hours after the department request, and that is new. to take note that time frame that documents need to be available. They also need to ensure that the documentation or information is required by this chapter to be submitted on behalf of a home health agency. The documentation or information is provided to the unit in the department, that is the Department of Health, that is responsible for licensing and monitoring the home health agency. And the next section is quality management. And the majority of this section, again, is new compared to what we had in the old rule. The plan for quality management needs to be established, documented, implemented, and it needs to include a method to identify, document, and evaluate incidents, a method to collect data, to evaluate the provision of services, including oversight of personnel members, a method to evaluate the data collected to identify a concern about the provision of services, a method to make change or take action as a result of the identification of that concern about provision of services, a method to determine whether the actions taken to improve the provision of services and the frequency of submitting the documented report required in subsection 3. Also needs to include each identified concern in subsection 1C and any changes made or action taken as identified in subsection 1D, and it needs to be maintained for 12 months from the date of the report submitted to the governing body, to the governing authority, and provided to the department within 2 hours of the department's request. Contracted services. The contracted services are provided according to the requirements in this article, and a documented list of current contracted services is maintained that includes a description of the contracted services provided. The next section is to 1206, and that is personnel. The qualifications, skills, and knowledge required for each type of personnel member are based on the type of services expected to be provided by the personnel member according to the established job description and the acuity of the patients receiving services from the personnel member according to the established job description. And it needs to also include the specific skills, knowledge, and knowledge necessary for that person to provide the expected services listed in the established job description. The type and duration of education that may allow that personnel member to acquire the specific skills, knowledge for the personnel member to provide that expected services. And the type and duration of experience that will allow the personnel member to acquire the specific skills and knowledge for the personnel member to provide the expected services listed in the established job description. The personnel member's skills and knowledge are verified and documented before the personnel member provides physical health services or behavioral health services and according to policy and procedure. And then the next item is the personnel members have the qualifications, skills, and knowledge necessary to provide services in the home health agency's scope of services. To ensure the health and safety of patients, as I mentioned, that's the prime concern here. And then a personnel member or an employee or a volunteer who has direct interaction with the patient for more than 8 hours a week provides evidence of R910-112, the freedom from infectious tuberculosis, as specified in the Arizona Administrative Code, which is R910-112. And that whole issue with TB and being free from TB is still being worked on by our epidemiology department. I'm not sure, but we may see some changes in that rule before the final rule, which is, no, we're not going to see any changes in that. Okay, I'm seeing a shaking head. Okay. Under the administrator shall ensure that a personnel record for personnel members, employee, or volunteer. The new item in here is that the individual starting date needs to be included. All of the other issues were already in the other rule. And the individual's qualifications have to including skills and knowledge applicable to the patient or the individual's job duties. Individual compliance with requirements in ARS 36411. The the CPR training, if required for the individual according to this article and the policies and procedures of the agency. First aid training, if required for the individual according to this article and policies and procedures. And is maintained throughout the individual's period of providing services in or for the home health agency and for at least 2 years after that last date the individual provided services in or for the home health agency. The next section we have is 1207, and that is the care plan. As you can see that some of this is verbiage or issues that are already addressed in the rules that we had previously. The changes here under the assessment is that with participation from the patient's physician, registered nurse practitioner, or podiatrist as applicable, or registered nurse. That assessment needs to include not only the patient's diagnosis, surgery dates that are relevant to the service that the home health agency is going to be providing, but the patient's cognitive awareness of self, location, and time. Goals for functional rehabilitation, if applicable, and the type and duration of frequency of each service that needs to be provided. Treatments the patient is receiving from a source other than the home health agency. And then with the medications, it's not just medications, but the herbal supplements that are reported by the patient or the patient's representative as being used by the patient, and the dose and the route of administration for those, as well as the schedule for administration for each medication or herbal supplement. Also needs to include the specific measures to improve the patient's safety and protect the patient against injury, and a discharge plan for the patient, including, if applicable, a plan for assessing the accomplishment of a treatment or therapy goals for the patient. The administrator shall ensure that the home health agency provides to a patient by the home health agency are provided to a patient by the home health agency according to the patient's care plan. The care plan is reviewed and updated whenever there is a change in the patient's condition and indicates a need for a change in type, duration, or frequency of services being provided. If the patient's physician, registered nurse practitioner, or podiatrist as applicable, orders as a change in the care plan, and at least every 60 calendar days. I think it was 62 days previously in the rules. Okay, the next, and once again, the 30 days for authenticating that care plan, 30 days is only the added information or the added verbiage there is calendar day. Then we have section 1208, which is the patient rights. The administrator shall ensure that the requirements in subsection B and the patient rights in subsection C are conspicuously posted on the premises, and that there are policies and procedures that include how and when a patient or a patient's representative is informed of patient rights in subsection C, and where patient rights are posted as required in subsection A1. And then we start with the list of what the patient is not to be subjected to. A patient is not subject to abuse, neglect, exploitation, coercion, manipulation, sexual abuse, sexual assault, seclusion, restraint if not necessary to prevent imminent harm to self or others, retaliation for submitting a complaint to the department or other entity, or misappropriation of personnel and private property by a home health agency's personnel members, employees, or volunteers. And a patient or a patient representative, except in an emergency, either consents to or refuses treatment, and may refuse or withdraw consent to treatment before the treatment is initiated. Except in an emergency, is informed of proposed alternatives to psychotropic medication and the associated risks and possible complications of a psychotropic medication, and is informed of the following: the home health agency's policy on health care directives, the patient complaint process, and then items that were in rules previously, home health services provided to the home health agency, rates and changes of services, etc. Consents, you have to obtain consents to photographs of the patient before a patient is photographed, except that a patient may be photographed when admitted to the home health agency for identification and administrative purposes. A patient has the following rights: not to be discriminated against based on race, national origin, religion, gender, sexual orientation, age, disability, marital status, or diagnosis. To receive treatment that supports and respects the patient's individuality, choices, strengths, and abilities. To receive privacy in treatment that was already in the previous rules. But we've added also to review upon written request the patient's own medical record according to ARS 12-2293-2294 and ARS 2294.01. They have a right to receive a referral to another healthcare institution if the home health agency is unable to provide physical health services or behavioral health services for the patient. To participate or to have the patient's representative participate in the development or the direct decisions regarding treatment. To participate or refuse to participate in research or experimental treatment, and to receive assistance from family member, representative, or another or other individual in understanding, protecting, or exercising those patients' rights. The next section is 1209, and this is medical records. Medical record is established and maintained for each patient according to Arizona Revised Statute, Title 12, Chapter 13, Article 7.1. An entry in a patient's medical record is recorded only by an individual authorized by policies and procedures to make that entry. That entry is to be dated, legible, and authenticated, and not changed to make the initial entry illegible. The order is dated when the order is entered in the patient's medical record and includes the time of the order, authenticated by a medical practitioner, behavioral health professional, or podiatrist according to policies and procedures, and if the order is a verbal order, authenticated by a medical practitioner, behavioral health professional, or a podiatrist issuing the order. If a rubber stamp signature or an electronic signature code is used to authenticate an order, the individual whose signature the stamp or electronic code represents, that individual is accountable for the use of that stamp or the electronic code. The patient's medical record is available to personnel members, medical practitioners, behavioral health professionals, or podiatrists authorized by policy and procedure. And the information in the patient's medical record is disclosed to the individual not authorized under Section A5 only if the written consent of a patient or the patient's representative, or as permitted by law, and the patient's medical record is protected from loss, damage, or unauthorized use. If a home health agency maintains patient medical records electronically, an administrator shall ensure that safeguards exist to prevent unauthorized access, and the date and time of an entry in a patient's medical record is recorded by the computer's internal clock. Patient information that is beyond what was in the previous rule have to include the patient's date of birth, the name and contact information for the patient's representative as applicable, and any known allergies, including medication allergies. The date the patient began receiving services from that home health agency, and if applicable, the date that the patient stopped receiving services from the agency. The name and telephone of a patient's medical practitioner or registered nurse practitioner, the name and telephone number of the patient's podiatrist, if applicable, and documentation of general consent, and if applicable, informed consent. Documentation of the medical history and current diagnosis, a copy of the patient's health care directive, if applicable. And then the rest of the new items start with laboratory, those things that are applicable, laboratory reports, radiologic reports, diagnostic reports, consultation reports. Documentation of a medication administered to the patient that includes the date, time of administration, the name, strength, dose, and route of administration. And for those medications that are administered for pain, an assessment of the patient's pain before administering the medication and the effect of the medication that was administered. And for psychotropic medication, an assessment of the patient's behavior before administering the psychotropic medication and the effect of the psychotropic medication administered. Other things that need to be included in the medical record are the identification, signature, and professional designation of the individual administering or observing the self-administration of the medication and any adverse reaction a patient has to the medication. Documentation of tasks assigned to the home health aide or other personnel. Medical records also should contain copies of patient summary reports sent to the patient physician, registered nurse practitioner, or podiatrist, and documentation of contracts with the patient's physician, registered nurse practitioner, or podiatrist as applicable by a personnel member or the patient. The next section is home health services. That's 1210. An administrator shall ensure that an individual is admitted to the home health agency has an order from the physician, registered nurse practitioner, or podiatrist for home health services. And the administrator will ensure that home health services director will ensure the nursing services are provided by a registered nurse or practical nurse according to their policies and procedures of the agency. The director will ensure that the registered nurse, and it goes on to speak to the registered nurse, unless a patient's physician or registered nurse practitioner orders only speech therapy, occupational therapy, or physical therapy for the patient within 48 hours. This is new. After the patient began receiving home health services provided by or through the agency. And the assessments for the patient to determine not only the needs of the patient, but the resources available to address that patient's needs, the patient's home and family environment, goals for patient care, medications used for patients, including non-compliance drug interactions, side effects, and contraindications, and medical supplies or equipment needed by the patient. And reviews a patient's health and healthcare directives at the time of the initial assessment. And immediately informs the patient's physician or registered nurse practitioner of a change in the patient's condition that requires medical services at least every 60 calendar days until the patient is discharged. Reassess that patient on the patient's care plan, needs, and medical condition, and summarize the patient's condition and needs for the patient's physician, registered nurse practitioner, or podiatrist as applicable. The home health services director shall ensure that verbal orders, the new item is verbal orders from a patient's physician, registered nurse, or practitioner, or podiatrist are, except as specified in subsection F2B, received by a registered nurse and documented by the registered nurse in the patient's medical record and authenticated by the patient's physician, registered nurse, practitioner, or podiatrist as applicable, with a signature within 30 calendar days. A registered nurse, except as specified in subsection F2B1 and 2, assign tasks in writing to a home health aide who is providing home health services to a patient and verifies the competency of that home health aide in performing the assigned tasks. And once again, there's verbiage for every 60 calendar days when the patient is only receiving home health services, but there needs to be an assessment. And under the next section, there needs to be verified competency of home health aide in performing the assigned tasks. And specifically those assigned tasks related to therapy services. And within 48 hours after the patient begins receiving home health services provided by or through the home health agency, conducts an initial assessment of the patient as specified in subsections B1A through F. Again, the home health aide, that brings that section to a close. The next item, or the next section, is 1211, which is supportive services. And a governing authority may include supportive services, including personal care services in the scope of services for a home health agency. And that supportive care administrator shall ensure that supportive services are provided to a patient according to policies and procedures. And a registered nurse assesses the patient's needs for those supportive services. And other than that, that is all of the changes in the new rules, or the additions as far as the new rules are concerned. And that's the end of the new rules. If you have any questions, I think we can entertain any questions that have come as you've gone through this, or comments. We have a number of people in the room who can help answer questions for you.